Sorry, excuse me. My name is Likumbi Kapia, and I'm the Hub Manager for the Social Enterprise Academy program at BongoHive. We do learning and development for individuals and organizations that want to create an impact. And today's session is particularly, we have been running some webinars for a month now, and today's session is particularly interesting and of importance because we're focusing on the for-profit health sector in Zambia. We're joined by two people who have experience in this. Great to have you too, Elizabeth. We're joined by two people who have got some experience in this space and are doing something innovative with the health sector, leveraging on technology. Now, why health? And of course, it's become increasingly more important post-pandemic, but just look at some of the statistics in the health sector in Zambia. 17 million, a population of 17 million, with a ratio of 1 doctor to 12,000 patients. In our 2019 budget, for this year, they allocated, for the budget announced last year for this year, they allocated about 10% of that to health. But we have some positive. We have universal free health coverage, and we also have the new national health insurance scheme. But we can see, I mean, just from our experiences as health service seekers, that there's a need for some sort of consolidated effort and support that where it works for the citizens. And part of this can come from such innovative solutions as and companies, enterprising individuals that we'll be talking to today. So on our call, we have Shakiree joining us from Virtual Doctors, and Tafadzwa Munzwa joining us from Dawa Health. I'll just allow each one of them to share a bit about who they are and what they do, starting with Shakiree.
Hi, everyone. Good morning or afternoon or early morning, depending on where you're calling from. So my name is Shakiree, as Likumbi has said, and I'm the Regional Director of Operations Africa for the Virtual Doctors. And the Virtual Doctors is a telemedicine organization that connects frontline rural healthcare workers with licensed specialists and general practitioners within their communities and abroad. And our application also comes complete with virtual resources that clinicians can use to increase their knowledge on different topics, such as medication interactions, evidence-based clinical pathways, and our most answered cases.
Awesome, thanks for that, Shakiree, and for that full scope of what Virtual Doctors does. And Tafadzwa, could you share a bit more about yourself and Dawa Clinic?
Okay. Good morning, everyone, or good afternoon, or good evening. I don't know where you're tuning from. My name is Tafadzwa Munzwa. I'm co-founder and team lead at Dawa Health. So we are a digital health platform that's currently focused on providing maternal health. So that's what we're doing. So we have an app. We also have chatbots. We also have self-monitoring kit. I think we will go into detail regarding that later on in the discussion.
Awesome, thanks for that, Tafadzwa. So as I can see here, there's a focus on maternal health and primary health care in both of your work, but also leveraging technology. But one, I think when looking at the work that you both do, and working at an innovation hub where people walk in every day and say they have great ideas, how did you come up with the idea for your product or service? And where did you see the need in the Zambian context for what you're providing in the health space? And I think I'll start with Tafadzwa on this one. So how did you come up with Dawa, and where did you see the need?
Okay, so we started back in 2018. That's when we had the concept. So originally when we started, it was focusing more on geriatrics, but then we got accelerated under BongoHive. Then we realized that the kind of persona we were targeting, they were not likely going to pay for the service, and they didn't really regard it as an essential. So after that realization, at the same time, my sister then got married, and she started having problems, accessing the basic antenatal care. So, we started thinking, okay, we had made this solution. We could also apply it, for maternal, for mothers and stuff. So that was the thought pattern. Then we pivoted from geriatrics now to maternal health. So back in 2018, we had made a a self-monitoring kit. It's a self-monitoring cardiology device. We also have a patent pending on that with African Regional Intellectual Property. So after that, then we tried to understand deeper on what the problem was and how we could leverage on technology to help mothers. So after that, then, we started doing our market research, trying to understand, okay, these are the personas we have, and this is the approach we're going to take. So then after that, then we made our chatbot, and now we have an app, and we also have a complementary self-monitoring kit that works with that app. We are listening out to mothers. So that's how we started, and we are here today.
Thanks for that. And sort of in the same vein, and I like the story that what you taught about pivoting, and that's quite essential when you're doing a revenue-based or for-profit model in this space. Shakiree, how did virtual doctors find its space in Zambia, and what was the need that they saw that they were going to fill?
Yeah, so our CEO, Mr. Hugh Jones, has worked in Zambia for a number of years, over 10 years actually, as a park ranger. He has no medical background at all, mostly business, entrepreneurial spirit. And while working in Luongo National Park one day, driving down the road in his 4x4, he came across a trail of blood. And just thinking that it was a wounded animal or some poachers, he was following the trail, and he finds a man pedaling as fast as he could down a dirt road with his wife on the back of the bike. And she was heavily pregnant and bleeding very heavily. So the hospital was about another 8 to 10 Ks away. And so he quickly put them in the back of the car and was driving as fast as he could towards the hospital. The mother and the baby lost their lives that day. And the husband went home with nothing. So upon further investigation, it was discovered that they did go to the first healthcare clinic that they reached that was closest to their home. But the healthcare clinic didn't understand how to stabilize them long enough so that they can safely be transported or referred to the next level of care. And I mean, this is an emergency situation, of course, and thus the virtual doctors was born. So what he noticed was that many people many frontline healthcare workers in the rural areas, yes, they have 2 years of education or 3 years or 4 years of education, but they're professionally isolated. So who do they talk to when they have issues or when they need a second opinion or they need some more information? Who can they reach out to? So that's kind of how virtual doctors came about, in making sure that there was some sort of support for the rural healthcare frontline workers that can help aid and give better quality of service to the community. So that's kind of how we got started there. And then the team was born.
Thanks for sharing that, Shakiree. That is really an inspiring is not quite the word, but really thought-provoking and backstory to how virtual doctors got started. But also, sad to say, such stories are not unusual in Zambia. And two things that you both highlighted is how your solutions are filling the gap in terms of access to care, but also in terms of, especially with virtual doctors, providing a community of practice for healthcare workers, frontline healthcare workers, and also sort of trying to address issues with quality of care. Yes, they may have access, like you said, to the first clinic they went to, but didn't have the suitable or relevant care that was needed for their situation. Similar to the situation Tafadzwa mentioned with his sister, having difficulty accessing the right type of antenatal care. In both of your solutions, you're leveraging tech for health. Can you speak more about exactly that sort of tech infrastructure and why you chose that, the app, or creating a community of practice through the app? Maybe I'll start this time with Shakiree.
Yeah, so the virtual doctors is all about tech. We first started out by piloting laptops in rural areas, just connecting the frontline staff with a medical doctor through a laptop. And we found that they were very cumbersome, and they didn't hold a charge as long as a tablet or, say, a cell phone. And then we moved to the tablet, but then quickly realized that case submissions were slow. However, we still received a lot of questions and inquiries. and it was mostly coming through text messaging, which, as we know, is not secure. So this is the reason why we created the Virtual Doctors app as it is today, on a smartphone. Because one, I mean, mobile phone penetration shot up drastically in the rural areas, but they were mostly feature phones, you know, press 1 3 times to get to letter C type phones. And so we actually realized that we needed to provide hardware with the application so that people would have access to it. And then our users were savvy enough to use the technology, which was great. And I think with virtual doctors, I mean, we've had a few issues when it comes to technology. There were a few challenges. I mean, one of them is connectivity in the rural areas, which I think is one of the reasons why digital health solutions, or even just digital solutions, are not prospering as fast as they can in rural areas. And there are some tech companies who are working on that. You know, there are organizations trying to solve this problem in conjunction with the telecom companies. Organizations such as Geeks Without Frontiers, Vonu is there, and they're finding ways to sustainably digitally connect people in the rural areas, which would actually increase the uptake of digital health solutions, as well as just whether you're in the fintech space, whether you're in the agriculture tech space, that would increase the uptake of these solutions, because people really need to know that, one, it's going to work. As soon as I hit the button, it should work, you know, and I need to have some guarantee that whatever's going to happen, I'm going to get feedback. So technology is here to stay. Digital health is here to stay. It's not going anywhere. We just need to make sure that people are connected, and that they're able to use the technology to the best of their ability, and that they're getting that feedback back as quick as possible as well.
Thanks for that. And it just highlights how much this digital transformation is important. It also has aspects, or can play an important role in making sure that people have access to quality healthcare. And that you decided to pivot from using a laptop to using the phones because of our context. And I know, Tafadzwa, for you, it's a bit different because you started with some sort of wearable tech, if I'm not wrong.
Yeah.
And care about that, choosing that unique tech pathway and where you are now?
Yeah, okay. So for us, like I alluded earlier on, we started mainly, we were a medical hardware company. When we started back in 2018, we had done our prototype, we had done, applied for a patent and all that. But after that, we realized that, we really needed a lot of capital to take that hardware off the ground. Hardware really needs a lot of capital. So we tried to see, okay, how can we leverage on the already existing technology to provide the same solution? So that was the thought pattern on us pivoting and trying to define the problem. And when we did our research, we found out that in Zambia about 7 mothers die every day from preventable pregnancy complication. This is just due to the lack of the right information and tools that enable them to make right decisions when it's the right time. So after that, okay, we tried to see, okay, what can we do? Then that's when we made our chatbot. So our chatbot was essentially a service that was giving out information to mothers. So you can ask it any question, then it's able to pick out key phrases using natural language processing, which is a field in artificial intelligence, and it able to give you a right response. So after that, we incorporated our chatbot on our website as well as Messenger, Facebook. But after that, we realized that, okay, some of these mothers coming from the low income communities didn't have access, to data to access our services on the app and on Messenger. So we started thinking around, okay, what are the mediums they are using to access information and stuff. So yeah, now we're working on integrating the same chatbot, on WhatsApp as well, so that you have a designated number where you can have interactive feedback with the chatbot. And then that's when we made our app as well. So our app works both offline and online. For the offline, you get the information basically offline. But if you want to connect then with the doctor, that's when you need the data. So that was the thought pattern on designing our app and the solutions we have today. So yeah, and we also now looking at integrating with USSD and SNS code, so that even if you have a feature phone like what Shakiree was saying earlier on, you're still able to access the information on your feature phone because you receive an SMS when you request the information. So yeah, that's what we're doing.
Thanks for sharing that, Tafadzwa and Shakiree, both, on how tech plays a role in you delivering this important service to people, especially in the rural areas where we know there's limited access or there's quite a far distance to healthcare centers. But I wonder why. I mean, this question always comes up when we talk about social enterprises, and I think it can be even more pertinent in the health sector because people feel health is a right. We have a right to access health. So why did you choose a for-profit or revenue generating model? Why are you not a charity? And how are you actually, what's the business model around what the service and product that you're providing in this space? And I think on this one, we'll go ladies first, Shakiree.
Thank you. Sorry, Tafadzwa.
Okay.
So with the virtual doctors, we are a bit of a hybrid, actually. So we're not completely for profit. And one of the reasons why is because, you know, when dealing with digital health or e-health solutions or just healthcare in general, you have to be very careful because it's a sensitive subject, right? And just like you rightfully said, you know, healthcare is a human right. At least I believe that. But there are two sides of that coin, right? So there's another side of that coin where it says healthcare services should be accessed by those who can afford them. And we thank God that there's not a lot of people who think that way, right? Not taking into account the quality of healthcare services. So if you have more money, you can access better quality healthcare services, right? You can go to the private facilities, you can have the best doctors. I mean, doctors spend, you know, 10 to 12 years in school and they deserve to be paid, right? So it's like, it's a fine line, and it can be very detrimental to your business if you're too much for profit, because then people will pull away from you, and then it can be detrimental to your bottom line because you're not making money. So how do you pay people? So like business models for healthcare services have to be rather strategic, and even more so for digital health. And for the virtual doctors, increasing quality healthcare services is a part of our mission. We started out as a charity. We still have charitable parts of our organization, which, like I said, is a hybrid. Our telemedicine application is completely free for any healthcare professional within Zambia and Malawi who wants to access that second level opinion or those virtual resources, right? So we have about 100 or so medical doctors that are consulting on our platform from various places. We have some in Malawi, we have some in Zambia, and then we also have some in the UK. So part of the revenue generating portion of our business is that continuous professional development points are a requirement of your licensure. You have to be sure that you are keeping up with what is going on in the world and what's going on in your line of business. And that's just not for doctors, that's for nurses, that's for clinical officers, medical licentiates, I mean, midwives, that across the world, across the globe. So part of what we do is we provide continuous professional development points that allow at a fee. However, all of that money is pumped back into the company. We don't have shareholders. We don't have individuals that get payouts. That money goes to the telemedicine portion of the company so that we are able to sustain and make sure that for the people in rural areas who can't afford, where it's really between, do I buy, you know, if you have a 10 kwacha, do I buy 10 eggs today? Or do I go to the doctor today? Do I buy this medication today? We can't, ethically, it doesn't make sense. And this is why healthcare solutions have to be a bit more cunning in how they generate revenue and making sure that people can access quality of care. Because for most of us, we do feel that it's a human right to have quality healthcare services.
I think we're definitely on the same page with that last sentiment, Shakiree, about providing healthcare being a human right, but also ethically trying to walk that line between being a for-profit and making sure it's accessible, while you're trying to ensure that your solution is sustainable, right? You don't want it to close the doors because you're not able to pay your bills, essentially. Tafadzwa, how have you managed to walk this tightrope between being sustainable, but also making sure your service is accessible to people?
Yeah, okay, so for us, the decision we've made, so we have divided our business model into, we are a for-profit organization, but we have divided our business model into two, which is the one catering, for the middle income to high income, then the other one, especially for the people in the rural areas and compounds and peri-urban areas. So information is free. So if you go and chat with our chatbot, it's free. Downloading our application, it's free. You can do all this stuff with a free app and free services. But then we have a for-profit component to that business, which is the self-monitoring kit. Because for us, we believe, the future of health, it's democratizing access and monitoring at patient level. So that's what we're trying to do. So we also have a self-monitoring kit we provide to mothers. So once you have the app and stuff, you can now lease out the kit we give you. So it has hardware like, blood pressures, urinalysis strips, HCG strips. It enables you to see the parameters of what's happening to you at home. You even get consultation from a doctor from your information. So that's the part where we are leasing out the solution. Yeah. So how we came out to that, so initially wanted to sell, then we realized that the selling price was going to be a bit high. So we went with the leasing model, reason being you don't need the kit after the 9 months or 10 months of your pregnancy. So we're trying to make it cheaper for you, but we retain the kit after you've used it because you don't need it. Then for the rural areas, our model, we're trying to partner with community healthcare workers. So we're talking with several partners. We have a broad network of community healthcare workers. So for these, we're going to be training the healthcare workers on how to use our service and kit so that they move around in the villages and or compounds. They are the ones who do the measuring. They put the data into the app. You still receive the same quality antenatal care, but at a subsidized fee because you're not having the kit at your home. So that's the model we've approached solving this problem.
Sure. I just see a question for Tafadzwa. Just to clarify something, someone had asked how much are the kits, but I'd also like to know, just to confirm, so it's the leasing of the kits as well as a subscription model. So for the 9 months, somebody pays a fee to use your service. Could you just clarify that?
Yeah. So our kits are going for, if you want to keep it at home, they're going for 100 kwacha a month. So we give you the kit, you take it home at 100 kwacha a month. Then for the rural areas, we're looking at 20 kwacha a month. So once you have subscribed to have a community healthcare worker come to place, do the measuring and stuff, you get the service at 20 kwacha. So yeah, that's the model we have.
Okay, thanks for sharing that. It's interesting how you've both approached, subsidizing your businesses from different ways. So I think Shakiree, for yours, it's more of one aspect of your business subsidizes the free one, and for yours, Tafadzwa, you've chose that different levels of customers. So middle income, the ones who could actually pay a fee, then subsidize the free services as well. Yeah. So apart from generating revenue, and this is just something I thought of as we were talking about health and understanding that people who are coming from that public health space, how else do you measure success of your business? So are there any particular health related metrics that you use to track your success? On that. Tafadzwa, what do you use? And I know you come from a health sector background, so.
Yeah, so for us, we're looking at the data which is coming into the app. The main indicators or key performance indicators we look at Dawa. It's how many of those people who downloaded the app or people interacting with the chatbot, are they coming on a daily basis, or they coming on? How often are they coming to use the service? For those who downloaded the app, how many active users do we have on the app? Then so yeah, that's our main key indicator. But we're also looking at other things, like the quality of data that's coming in. So we want to see, okay, for the mothers who are using our kit, how many of those are able to make decisions early before any complication. So we know from week 20, mothers are predisposed to having pregnancy-induced high blood pressure. This can lead to a number of things in a pregnant mother, even miscarriages. So we want to see, okay, from week 20, on those who are using our kit, they're able to see their blood pressure on a daily basis. So when it starts to spike up, are they able to, reach out to either a clinic or a specialist early, and we prevent any complications. So those are key performance indicators. Trying to see, okay, on those who are using our services, how many are having complications or are reporting, to have complications. So that's what we're doing.
All right. Sorry, just before I go to Shakiree, just on an impact level, and I know internally at BongoHive, I'm always the impact person, but at an impact level, let's say at a national scale, things that we measure on a national level, what would you hope to see would change when we do our Zambia demographic health surveys? What would you hope to see would change if more solutions like yours came on board?
Yeah, okay, so that's one of our key target for 2030. So we have set a 10-year plan for Dawa Health. So currently, like I told you, in Zambia, we have about 7 mothers who are dying daily from pregnancy-related complications. We hope to have at most 3 by 2030. So we are hoping, we partner with all these organizations and people who are working in the maternal health space so that we bring down maternal mortality from the current 7 at least 3 by 2030. So we hope, with organizations like visual doctors and other players in the health space, we can work together and bring maternal mortality to at most 3.
Awesome. Thanks for that answer. So Shakiree, how do you guys measure success, and what is the high impact level you'd like to see, in 10 years?
Yeah, so at Virtual Doctors, we work mostly with the frontline healthcare workers. And on our application, we do have a dashboard that we're able to see exactly what the healthcare workers are sending, what cases they're sending, how long it takes to respond. We have 24 specialties on our application that a rural healthcare worker can send cases through. So things such as OBGYN services, we have radiology, we have general practitioners, we have urology, we even have lab specialists. So if you needed an x-ray read or something like that, you can send a picture through the application to the radiologist so that they can read that. And so some of the things that we look for in making sure that we are achieving the impact that we desire is, one, what types of cases are coming from the field? And just speaking on, how do we insert into the greater broad picture of increase in quality of health? One of the things that I've noticed is that if we get a malaria case, that's very odd, right? Because why would you need a second opinion on a malaria case? Most of the malaria cases are not as complex, right? And malaria is, it's relevant. It's here in Zambia. We know how to deal with it. We know how to treat it. It's something that we've been dealing with generationally, even before we had westernized medicine. So for them to send a malaria case, I have to call and I have to ask, what's going on? Is this really a case, or are you just wanting to play around with the app? So then if we see an increase in certain cases that I'm like, okay, this might be a situation, then we're able to escalate that to the next level of care, whether that be the provincial health directors, the district health directors, or even to the national level, whether we need to go to Z and PHI and say, look, there's a suspected Ebola case on the border of so-and-so. Can we please, we need to get some more information about this and see what support we can get to that area. So those are some of the data that we're looking at, and some of the cases that we have seen through the virtual doctors. Luckily, when we did have a suspected Ebola case and we called, we found out that he was actually just in his textbook and he wanted to get more information about that type of case. We literally, all of the flags were raised, and it was amazing that Virtual Doctors was able to do that and to help that and to resolve that very quickly. So like going back to, you know, what type of impact? One, we need to increase that doctor to patient ratio, right? You said 1 to 12,000. Well, I mean, doctors are also needed in urban areas, and a lot of them want to live in urban areas. I mean, you can't blame them. It just is what it is. So how can we get the doctor as close as possible to the patient without actually having the patient leave their community to see that doctor? So that's some of the impact data. Also, how can we decrease unsafe referrals or decrease referrals in general for things that are chronic, things that we can handle at a lower level facility, therefore decongesting some of these higher level facilities where people really need to be seen. We need to decrease those wait times for patients to see doctors, which we do have a response time within 24 hours. It's not the best. It is something that we want to decrease, and that would only decrease with more doctors coming onto the platform and consulting on cases. So yeah, those are some of the things that we look for, some of the impact that we hope to achieve, and also working with other partners and making sure that we can create an e-health or digital health ecosystem around not just rural, but urban, peri-urban, you know, give the doctors more support to do their jobs, give the clinical officers more support to do their jobs. You know, I mean, the doctors like all the way up here, which is great. I mean, I get it. However, these frontline rural healthcare workers, the frontline workers are usually the ones who are also in the battle against everything. They're the ones who triage first. So if we don't beef them up and empower them and give them more insight into what they're doing and how they can deal with patients, then everything is going to be on the doctor. And they're already stressed out. So those are some of the impacts and the things that we're tracking at Virtual Doctors.
Awesome. That does sound quite evolving, and I'm glad you had well said, Shakiree. I'm glad you had you resolved that Ebola case quite efficiently. But it also brought to mind, and I think also when Tafadzwa was talking, brought to mind as you talked about partnerships, how you interface with the biggest partner in the healthcare sector, which is the government. How do you work with the Ministry of Health? How do you work with the ZNHPI? Like, how are those actors influencing your work, for good or for bad? Shakiree, would you like to start?
Well, I mean, it's rather hard to work in the digital health space without having the government, without working also with the government's healthcare system. They have to be a partner from day one, because I mean, you're going to be collecting data on the general population, and that will eventually put you on their radar, whether it's going to be in a good way or it's going to be in a bad way. And the Virtual Doctors, we do have a memorandum of understanding with the Ministry of Health here in Zambia, and we work under their direction. We don't deviate, and the difference between maybe the for-profit side or not even say the for-profit side, the revenue generating side and the telemedicine side is that the telemedicine side is almost exclusively inside of Ministry of Health facilities. So we don't go to private healthcare companies or clinics or any of that to offer this service, because they have the systems that they need. I mean, they have greater systems, let's say that. They may not have all the systems, they have better systems. So we need to be able to strengthen where we can and what makes the most sense and the greatest impact. So working under the direction of the Ministry of Health is imperative. You can't do anything in this country in healthcare without having their sanction, truly, unless you're going to be working in the private healthcare atmosphere. But we also work with government institutions such as ZNPHI, which is the Zambia National Public Health Institute. And just recently, we provided some information about the COVID-19 pandemic response and what our facilities, the 140 that we support, what their readiness was. to handle the COVID-19 pandemic. We conducted a survey on their water, sanitation, and hygiene protocols. What things do they have? How many wash stations do they have? Is there a wash station on the outside of the facility? Is it on the inside of the facility? And we were only able to do that because of our network and our constant communication with our healthcare facilities. And so we were able to do that and kind of beef up their response a bit so that they are able to help. And we also gave that information to other providers such as World Vision and other NGO partners.
Thanks, Shakiree, for that really full answer, comprehensive answer of how government's interfacing with how you're working. And I think it's a bit different on your aspect because, like you said, some of your services are inside health facilities and you do work with community health care workers. Tafadzwa, that's a bit different from you because you're working with private citizens mostly, isn't it?
Yeah. Yeah, so for us, yeah, like right now, we're still mainly operational in the private sector, but we're looking into expanding to public health sector as well. We had a meeting with UNFPA, then also other NGO partners, so that we extend our services to the public health sector. So yeah, but we're still operational in the private, mainly in the private healthcare sector.
Maybe related to that, and I think just share your thoughts. I touched on it in the beginning about we now have this national health insurance scheme. How does that government policy directive affect or interplay with your work? And maybe I'll start with Tafadzwa on this one.
Yeah, okay. So, I think, it's important that government is putting in place policies like that. But I think, for us personally, coming from a private sector kind of bias, I feel like, more could be done, to help innovation and, more of e-health and digital health innovations in Zambia. From my experience or from our experience as Dawa Health, when we started out and, trying to partner with all these organizations and pilot our services and stuff, some of, I'll try to be careful here, some of, the clauses from organizations like Zamra, I think they're still inhibitory, to digital health solutions in Zambia. I think probably, they were probably set back in the 80s or 90s. I don't know. So I think there's need of restructuring that, to still protect the sector, but at the same time, allow, innovation in the sector. So, that's how I feel about policy, but, it's more than policy for e-health. It has to be like an ecosystem. So we need a lot of players in the ecosystem, government is one. If we look at countries like the Israeli and Rwandan government, the government has been hands-on, in trying to improve innovations in the country, and we can see the results right now with what those countries are doing. So I feel like, yeah, government can do a lot, because they have the authoritative, final say on innovation and stuff. But we need things like skill as well. A lot can be done trying to beef up the skill in the country. For us, like, we're leveraging a lot on machine learning and artificial intelligence. That is a skill that is still in low supply in Zambia. We don't have a lot of people who have the skill to do that. So I feel like there's a lot that can be done with partners to train more people and institutions to try to get more people into such fields. And also I'll talk on incentivization. So there's a lot that can be done from the government as well. The government can incentivize innovations, try to help them in maybe, I don't know, lower taxes, if that's something that's viable for them, for innovations to come into the sector. So yeah, I feel, around those areas, more could be done. They're doing great, but more could be done.
Awesome. And thanks for that. And you rightly said it does take an ecosystem approach to leveraging it to, I think one of you had a quote about leapfrogging, using tech or digital e-health to leapfrog some of the challenges we have in the African context. And that could be not just policy, it's also things like, of course, infrastructure and access to the internet. But if where possible, tax policy, if possible. Shakiree, how is virtual doctors interfacing with the government, the Ministry of Health? How is the health insurance policy affecting your work?
Well, it's not affecting our work as much as one would think, mostly because we deal with the healthcare provider. We did pilot with working directly with the patient, and found that there was just too much of a gap, like connecting the patient directly to the doctor. There was just too much a gap in medical knowledge and medical say-so to have that happen. I mean, we had a case where we had one patient who had a TKA, which is a total knee amputation. So like right above the knee, right? And we were following up, and we gave her the device, and the doctor was, communicating with her, just trying to see, how is it going, to do follow-ups, right? And so the doctor asked her, well, how is the wound? Is it hot to the touch? Does it have a foul odor? Those sorts of things. And she says, no, I'm fine. Well, we sent someone over there, and come to find out she's in full gangrene. And it's just because that information, like that disconnect between, it's like if it's not hurting, then it's okay, So it's like the medical information disconnect. It was too great, which is why we had to go with the healthcare service providers, also talking to other healthcare service providers. And it actually increased mentorship. So I don't see in the current national health insurance bill or plan where they're focusing on healthcare providers. They're mostly focusing on the patient and how the patient is receiving services. Now, one thing I am interested in is the quality piece that the national health insurance bill is supposed to tackle. I come from U.S. healthcare systems. I'm sure you guys can tell from my accent that I'm not Zambian. However, I am Zambian, so don't get that confused. I love Zambia, probably too much. But one thing that I'm very interested in is how they're going to measure quality, and that whole pay for service piece and that pay for performance piece, which I think is where virtual doctors and other digital health and other solutions can kind of come in and insert themselves. Because how are we going to track the types of services that people are coming to the healthcare facilities for, right? So like if, for example, we have in the national health insurance bill that someone comes back to the hospital with, someone comes to the hospital with a cough, right? And then they come in, the patient, the healthcare worker treats them, and then within 3 days they come back with the same problem. Well, what did you do the first time where the patient had to travel, had to get their transportation money together, had to take off work, had to do these other things to come back? So it's like, what was the visit the first time? What treatment did you render? And should we as a government, as the national health insurance reimbursement plan, should we pay for that first visit when we have a revisitism of like, I don't know, 30% for certain patients? You know what I'm saying? And then we have a case where, is it because you don't have enough health staff? Is it because we don't have enough skill? Is it because, so like there's a lot of questions that can be answered that I think the national health insurance bill will tackle. And my main focus would definitely be on that quality piece. And I think for virtual doctors, we can definitely help with that. And going back to what Tafadzwa was saying about the ecosystem, what you said about the ecosystem, if we don't start creating these partnerships and these players now, then we're going to run out of money. I mean, because why do we keep paying for things that are not of quality? If you understand what I mean.
I hear you, and that's a very passionate response. Thank you for that. I just want to highlight some that you mentioned when you were talking about the work that you do, and you mentioned providing health centers, facilities readiness for COVID. How has this pandemic, have you changed what you're doing? due to this pandemic? Do you see any opportunities at play for this sort of private sector, public sector partnerships because of the pandemic? And I'll start with Tafadzwa again. Sorry, Tafadzwa, you're on mute.
Sorry about that. So I was saying, for us, initially when like the pandemic hit, we had a bit of, problems trying to get more people on board and stuff because of the restrictions and stuff. But now I think, it has helped us in a positive way. We are having, people willing to take up our services more. We're signing more agreements now, trying to have more partners as we can. So I think it came in a bad way, but now it has a positive outcome, So yeah, that's what we've been able to do, and I think now, it has changed the mindset in the local space. People are now willing to take digital solutions because that was the day-to-day way of living, during the pandemic. So even post-COVID, I see, a lot of opportunities, with partnering with the public health sector as well as, more private sector players and, to deliver a solution. So yeah, I think, it came in, now has a positive outcome as a result of everything that happened.
And Shakiree, what opportunities, beyond really providing those essential data to the Ministry of Health on the readiness of health facilities, how do you see the pandemic affecting how you do things? And yeah.
Yeah, I would definitely agree with Tafadzwa that COVID-19 has revolutionized the way people think about digital health solutions and about just digital anything at the moment. A lot of people are medically distancing, they're socially distancing, and people just want to stay safe. So I think that if anything, it's just going to increase the innovation of people, the innovation of the digital health sector. I would say, like, as far as how it changed our way of work, we have focused a bit more on making sure that our app can be downloaded from like the App Store, because we originally have the plan of going and giving the devices with the preloaded apps to the healthcare workers, just simply because some of them don't have smartphones, which actually may, if it does become app only, which it will be before the end of this year, it will leave out some healthcare facilities. It will leave out some people because some people don't have smartphones. So those are challenges that we're definitely have to overcome and see how we can work with the Ministry of Health in order to make sure that these people are covered as well. But yeah, everything has gone remote. We've done remote trainings. We've even started to engage our clinical officers in a way where they do what we call healthcare show and tell, where they pick cases and share their experiences, because a lot of people think that, at least, there's a medical hierarchy, right? So like, a lot of people think that frontline healthcare workers don't have anything to say, they don't have enough experience, but that's just simply not true. And a lot of them are going to be at the front lines of this COVID-19 pandemic. A lot of them are going to be our angels when the time comes, and I pray it never comes, but we have to empower them now. We have to give them the information now. We've beefed up our virtual resources. We've given them copious amounts of information about COVID-19, about disinfecting surfaces, about even just how to isolate when you have 3 beds in a room, because that's the reality of some of these healthcare facilities in the rural areas. How do you isolate when your whole healthcare facility is only 4 rooms? One of them is a waiting room, one of them is medications, and one of them is a observation room. So how do you isolate in a 4-room facility? So these are some of the challenges and opportunities that we're working on, and just trying to make sure that we can help where we can.
Thanks for that, and also providing the context of how of where you're providing these solutions. as I said before, and full disclosure, Tafadzwa has gone through one of the BongoHive programs, but at BongoHive and through the academy, we're really interested in supporting enterprises, businesses, whether they be a hybrid model or social enterprise, that really, we say, creating viable solutions to solve the world's pressing problems. And you're the great minds that we work with. But do you see, especially when you talk about ecosystems, where is it where we could have, where other for-profit or hybrid models of businesses could come in and sort of fill the gaps to the services that you're providing? So what's in the value chain of what you do? Do you see opportunities where somebody could provide a business or enterprise solution to what you do, what you're doing? And that's part one. I'll do a part two. What sort of support do you guys need to scale? I'll start with Shakiree.
Okay, so that question was kind of long, so I had to break it down a bit. But what type of support do we need? The value systems and the value chains and the different gaps that I see in the market, right? In the digital health market. One thing that I've seen is that we do need diagnostic testing. I was actually really excited when I found out that Dawa was actually giving leasing or selling, or at least providing some sort of diagnostic testing to patients, which I think is a great innovative way to, one, get people to enter back into the healthcare system. Because due to COVID-19, a lot of people are scared to even walk into these healthcare facilities. So we have people, I mean, I don't know if you saw the latest COVID-19 statistics from Zambia, but they had BID, brought in dead, okay? 10 people brought in dead that they suspected was COVID-19. Now, of course, we have to do autopsies on these people, but at the same time, why are they not intervening with the healthcare system earlier than that? Which is one of the innovative. I think if someone can come up, I would love to be a part of a e-health, digital health, healthcare management ecosystem. I mean, sorry, I am very passionate, so please excuse me, but I would love that, where people can come together to create healthcare solutions for these complex problems, because now people are not entering the facilities. They're not intervening early. So like working with the community health assistants, working with the community health volunteers could be a strategic entry point to get people back into the facility. But also allowing people a bit more autonomy in their own homes, but that also comes with a lot of education. It comes with a lot of public health promotion, a lot of training on how to use these things. And if you see this number, what does that mean? So like those user-friendly interfaces that can work for the public, that are not so technical, they're not so medical driven. But maybe if you say, okay, you're getting your diabetes test, right? And you're doing it at home. And then there's a red, sad face, meaning that it's too high, a yellow, meaning you're almost there, and then a green, that's easy for people. To be honest, most people don't even care about the number. They don't understand the number. So like creating those interfaces that make more sense for like end users who are not tech savvy, end users who are not medically savvy as well. I think that those are some of the interfaces, and also someone who can bring together all of the players, because there are tons of NGOs right now that are trying to solve the problem, and God bless them, God bless us. But at the same time, these people are not companies that are going to stay. Once the project is over, who's going to take that up? So we need to find sustainable solutions. So like use the NGO money, use it. But don't use it without the sustainability plan from the beginning. Like, do what you need to do in order to make sure that when this is over, we can still continue. Because healthcare services leaving at the drop of a dime means that people will die.
Exactly.
So we need to work on those things in the beginning.
we really managed to get Shakiree riled up there, but thanks for that passionate response. And
yeah.
really, I think what you said in there about when programs decide to leave, people will die, or healthcare solutions, and that's one of the reasons why we're so focused on it being an enterprise or a business, that type of model that's not relying on program funding that's got a horizon or a sunset, something that's more sustainable or at least hybrid. Tafadzwa, what's your response to the support you need, and where there are opportunities for other enterprises?
Yeah, okay, so for me, I think I'll start more on the opportunities side. For us, like what we're doing at Dawa, we need to procure a lot of, this equipment. So we don't have enough players, who are in the medical logistics space, specifically providing, equipment for startups like us, or even maybe, pharmacies and all these guys. We can have disruption around, that area where we get those medical supplies at a lower cost. So I think, there's an opportunity in the medical logistics space. Then also, since for us, we're focused currently on maternal health, I feel, there's a big gap in the chronic health space. Things like diabetes, all that stuff, people are getting more diseases, even chronic diseases and genetic diseases. I think, we can get more players in that area to address such problems. So yeah, I think, people can come up with great innovative solutions to help, people who are living with genetic conditions, because it's a chronic condition as well, or it's like sickle cell or diabetes. So yeah, that's on the opportunity side. Then on the kind of support we need, I think, just to allude on to what Shakiree had said, we need a player who try to bring, all these players together so that we try to collaborate and work together. So I think, it'll mitigate the risk we have as startups as well as NGOs, leverage on each other's skills. I think we can deliver better health solutions to the public. So yeah, that's my contribution.
Thanks for that, Tafadzwa. I see both of you have shared some really interesting and exciting ideas. I hope to see some ideas like that come through the BongoHive ideation bootcamp called Discover, and try their hand at seeing if that's a viable business solution. But we've got some time here and a few people listening, and maybe also on Facebook watching the live stream. If there are any questions from the attendees, please feel to drop them in the Q&A section right now, and we'll take any questions from you. If you want any of the panelists to elaborate on any of the points that they mentioned earlier about their business, about how they work, maybe their plans for the future, please feel free to put that in the question in the chat box. But as you were talking, I think I'll ask one of my questions, and maybe you could share your reflections. As you're talking about having different ecosystem players, government, and specifically to do with how tech is helping a service or provide access to service for people, I couldn't help but draw some comparison with what's happening in the financial services space with fintechs. And there seems to be a more coordinated effort from government, regulatory bodies, from corporates, commercial banks, all trying to make financial services more accessible using tech. And it's just an accepted thing. What do you think is missing in the health sector where e-health is it's not a movement like fintech? And maybe starting with Shakiree on this, why do you think e-health is not a movement?
Well, I mean, I think e-health is not a movement because it's hard to make money from it. I mean, I used to work in the fintech sector, very short while. And all you need is some transactions, and there's a fee, and you can make, they say every overnight success took like 13 years. Well, in fintech, I think that you can cut those amount of years in half, because money transactions and using online anything is just increasing. Now, when it comes to healthcare, just as I was stating before, you skate a very thin line, because there are some people who are willing to pay whatever it costs to be well. But as we know, money does not necessarily equate to health. in the sense that, yeah, you may have less healthcare disparities. You know, like even here in Lusaka, we're more privileged than someone who lives in, let's say, Rufunsa. You know, so like, and they're not even that far away. But just because we have more access here in Lusaka than someone, say, in Rufunsa, it creates that potentially, I mean, I don't have any data on this, but if you go to the US, there's tons of data on it, you know, where someone who lives in a city may have better health outcomes because they have more access, more money. But how do you make money from the person in Rufunsa on the healthcare system when the general idea is that everyone deserves quality healthcare regardless of their ability to pay? So it's not a sexy thing, you know what I'm saying? It's not going to make you a millionaire overnight. And I do say, if you come into the digital health space, just know you have to be here for the long haul. This is not a short ride to success. It's not a short ride to being a millionaire. So that's why I think it's not as as coordinated.
I mean, like they say, money talks. So, but health is wealth. So Tafadzwa, what are your views on this?
Okay, so for me, I think, the initiative has to come more from the government, because it's them who like have the budget and the resources and the money. So I think, if we have a coordinated approach from the government, it becomes sustainable. Everyone now wants to be a player in that sector. So I think, if we have an initiative either from the Ministry of Health, to try to bring all these partners together so that we provide more of innovations in the space. We also bring down their cost, that the budget they have for healthcare will go down, because if people are having preventative measures more and they're accessing information more, it lessens the burden on the ministry or the government. So I think, the initiative has to come from the higher places. So yeah, those are my 2 cents.
Awesome. Thanks for your reflections. And there's a question here from Alice. Thank you, Alice, for your question. And it's, what advice do you have for young people who are in the early stages of developing a social enterprise in e-health? I'll throw you in, whoever wants to take it first this time. Quickest one to the button.
Okay, yep, got the button. So what advice would I give a young person who wants to enter in the e-health space? I would say, number one, you have to have a heart. Like, it can't all be about the money when it comes to e-health or digital health or healthcare in general, because a lot of your customers are not going to be able to afford your service, but you have to be able to offer, just like Tafadzwa has, you got to have that tiered system of revenue. You have to have some people who pay a little bit more because they live in Lusaka and they have access. And then the people in Rufunsa, maybe they pay a little bit less because they don't have access. And you don't want to make it a battle between, do I eat today or do I buy this healthcare service? Because if that's the battle, then my stomach hurts way more than than my leg. So I need to eat, so just understanding that this is a long haul and that this is, and you need partners in order to get this done. You need partners.
Well, Tafadzwa, what advice would you give, having,
Mine was going to be on partners, and Shakiree said it last. So I think, if you want to get into the e-health space, you need partners with a big name. It becomes easier to work in the communities. Even if you're being introduced, they'll ask, who are your partners? So I think that's really important. And you also need the passion. So it's going to be really hard, trying to figure out all this stuff. And like what Shakiree said, most people are not willing to pay a lot for these kind of health services. So you need to find a way on how you're going to make, your solution sustainable at the same time helping people. So yeah.
Thanks for that on both. I mean, I would add one bit, if I could plug what we do. We do help people at BongoHive and through the academy, help validate their business ideas, prototype, and try to link them to those partnerships. It's our passion. And also reminding them, especially for the social enterprise space, that it's not all about money. We always use those 3 Ps, people, planet, profit, but there's a reason why we always say people first. Your solution is for people. And so if you don't consider that in what you're making and whether they can afford it or access it, it may not have legs. there's one more question here. Thank you, Elizabeth. And it's maybe more to Tafadzwa. It says, how do you address the rural community members that are not tech savvy? Shakiree addressed it a bit for virtual doctors. But how do you find, Tafadzwa, find that people in the rural, do you find that people in the rural area are able to use your platform?
Yeah, okay, so thanks. It's Elizabeth who asked that question. I think Elizabeth, right? Yeah, okay, thanks Elizabeth for that. So what we're doing at Dawa Health, so our solution like needs a lot of people who are like really tech savvy. So that's why I said earlier on, we also have an alternative solution, which is USSD SMS platform based. We are integrating that now. It's not yet live, but our approach to that, we are partnering with organizations like Amref Health and also Tishi's Health Association of Zambia. These are big players who are working in the low-income communities, especially rural and peri-urban areas. So, you know, they have a network of community healthcare workers, they do training programs and all that. So that's why we partnered with them. So, you know, that we get our services, you know, to the network of the community healthcare workers they're working with. And, you know, they have the education, they're having the training side from our partners, then us, we are providing the solution for them to take it to the end user. So that's the approach we have. So yeah, for someone in the rural areas who's not that tech savvy, you know, they're going to get help from the community healthcare worker because the community healthcare worker is getting support from organizations like AMREF and CHAS. So that's our model.
Thanks Tafadzwa for that. I think we're just getting to the end of our session, and I appreciate everybody who logged on and took the time today. Thanks, Elizabeth, who took the time today to join our call. I just wanted to close with maybe one word of how you feel. We do this in our SEA sessions. How you feel about the Zambian health sector now? What is your especially what we've gone through with the pandemic, how you've seen people come together, or even just, you know, the gaps that what's the one word that describes your sentiment about the Zambian health sector, public health sector at this point, Shakiree?
One word. I have a lot of words. But one word I would say well, that's not one word either, is it? I would say partnerships. Yes. I was amazed at how quickly they were able to gather as many people as possible and really get everything done.
Mm-hmm.
Yeah.
It's good one, partnerships. Tafadzwa, your word?
For me, I think it's excited. You know, we're getting the mindset shift. We're getting more people in the sector, and I think, you know, it's a growing sector. I believe in the coming 10 years, it will be like it will be a big movement as well, just like fintech. You know, because we're having collaborative effort from all these partners. So my word is excited.
Awesome, and I think my word will be, and it's not a surprise. It's innovation. You know. There's a lot of innovation in this space, and like Tafadzwa, that makes it exciting, or makes me feel excited about what e-health could do for the future. Thanks again to everybody who attended. Just to say that if you'd like to share this webinar with others, your colleagues who are in the space, who may want to get some tidbits from it, we'll have it up on our website later this afternoon, the recording of it. We also have other webinars focused on traditional entrepreneurship and corporate innovation. And we also have webinars called BongoHive X series, specifically focused for students, especially in tertiary organizations. So you can find all that information on the BongoHive website. I thank everybody for attending this, and I really hope we could see something future, something coming out of this discussion. I already have been thinking about whether we could support a boot camp specifically on e-health solutions. We already are doing that for EdTech and for FinTech. And so maybe you've given me hope that there's space for a need for an e-health sort of solution or accelerator incubation program. Thanks again for everybody who came, and we'll see you online. Have a good day, everyone.
Thank you. Have a great day.
Yeah.